I had my 2003 normal mammogram during Ms. Cappello. We are pleased to inform you the results of your mammogram are normal. Beautiful. What do you do at 51? The next step is you have your colonoscopy. And prior to that, I had my yearly gynecological exam. Again, never missed an appointment. Followed all the rules from the American Cancer Society, other organizations about keeping breast healthy. 6 weeks after my 12th normal mammogram, I had my annual gynecological exam. My gynecologist felt this thickening in my breast and said, I know you just had a normal mammogram, Nancy. Because I feel something, we're going to send you back for another one. She did send me back. My mammogram was normal. Because it was palpable, this ridge, the standard of practice is you go for an ultrasound. The ultrasound, I knew I was in trouble when I was laying down and getting the ultrasound, and all of a sudden from one technician or technologist came 6 people hovering over me. One very good looking doctor who I actually thought was really pretty good, and I knew this is not good. The cancer was illuminated on the ultrasound, remember this, yet not seen on the mammogram. Fast forward, stage 3C breast cancer, there's 4 stages. I was on stage 3, which means my cancer was 2.5 centimeters. It was the size of a quarter. It had metastasized, which is traveled to 13 lymph nodes. What happened? I couldn't believe it. The first thing I did, I went to the American Cancer Society stage of diagnosis, and I want to know what the heck does stage 3C mean? And when I ever saw that stage 3C means that less than 49% of women survive 5 years. Are you kidding me? I never missed an appointment. So I went back to my team of doctors. When you're a breast cancer patient, now you have a team, and I said to each of them separately, what happened? And each of them said to me, you talk about being stunned, Joan, in a nonchalant manner. Oh, Nancy, you have dense breast tissue. I wrote it down. I'm an educator. I didn't start my career saying I'm going to speak about my breasts to strangers all over the world. I was an educator. I had my pad and my pen, and I wrote, dense tissue, what's that? And each of them proceeded to tell me, as the density of the breast increases, think about this, and I'm sure Dr. Smith will probably have some pictures. There's four categories of density, from fatty to extremely dense. I had extremely dense tissue. It was reported in my report that I never got for 12 years. And so now I said to my docs, isn't this breast backwards? You're telling me now, after my advanced cancer diagnosis, that I have this dense tissue which could harm me and could still harm me? I'm not out of the woods yet. My type of cancer can recur 10, 15, 20 years out. Every day is a blessing, believe me. But I certainly am at risk of dying prematurely from this disease, and I am not happy about that. And so what do? I went back to my docs, and I shared with the literature that I read a decade ago. The literature a decade ago was a decade old. Now it's 2 decades. And here's what the literature, the science said. 40% of women have dense tissue. As the density increases, the reliability of the mammogram plummets. There are other tools, such as MRI or ultrasound, that can find cancers that mammogram miss. What? Went back to my docs. Again, I'm an educator with a pile of stuff. Literature, I'm going to educate them. And each of them said to me, oh, we know that. I said, can't you start telling your patients, like 40% of us, about our dense tissue? Just in Connecticut, that's my state. I didn't think about, oh, I'm going to talk to people in California or all over the world, or actually come to Washington. And each of my docs said, no, we can't do that, Nancy. It's not the standard protocol. Now I'm in the middle of treatment, drains hanging, trying to survive, not figuring out what I'm going to do. Am I going to live or die? My husband, Joe Cappello, who is here, was just as devastated. It's a family disease, as you know. He said to me, you can't let this happen, Nancy. We have to do something about it. So we went to our legislators. Now, isn't that really breast backwards? We had to count on legislators to get this information because our docs refused to do it. I mean, that's crazy. But that's what happened. And through lots of drama, 8 or 9 years of drama, finally, in addition to an ultrasound coverage bill, in 2009, Connecticut became the first state in the nation to report density, disclose density to the patient through the mammography report.